This dog is how old already? This
We actually don't know because it's a dog one.
this one is a palm, right?
Yes,
This is a palm.
Okay, at least 6 or 8 years old from the breeder. Okay, so now the thing is, the main complaint is actually this one, right? Let me see the discharge, right? The main complaint, the discharge
And then the hind
from the
leg
vagina.
got no strength.
No strength due to the passing of the blood
Is it?
until very weak. Okay.
Just now she eat.
Actually, the main is really now
She
she's
cannot
looking very
stand.
weak already.
Yeah, very weak because 5 days already, right? 5 days, is it 5 days?
Yeah, 5 days.
Huh? 5 days of passing discharge from the.
But her she
Vagina.
cannot move. It's
Swollen.
only like 2 days only.
But this part swollen is when was it?
Last
See,
night.
how come, right?
Last
Swollen.
night, then we noticed.
This swollen means the womb, the birth tubes are swollen with pus. So if we want, then we can confirm it by X-ray or blood test. So diarrhea is how long? Diarrhea also
On and off, on and off.
vomiting.
No vomiting.
Yeah, there's pain and crying. Pain. And this when was the last hit? The bleeding?
Yes.
June.
June.
June and December.
So now is what? Now is October, right? So October, correct lah. So October. So normally the pus will come out in 2 months after June. August. August anything?
Nothing.
Hmm?
Nothing.
So it's 2 to 4 months. Okay, 2 to 4 months. So the best is we take a blood test to check whether the kidney and the liver is damaged or not. And then because it's purple already, so we can't do any operation. That purple no.
Oh, already.
No, because not enough oxygen. The tongue is purple, so they give the drip, and then take the blood test, and then once it's better, then we operate and remove the birth tubes. Today is October 4th, 2016. This pom from a breeder was really unable to walk last night, so the owner brought her here, and there was the vaginal discharge for the last 5 days. According to the owner, the dog could stand up away from the fridge when he goes there, but this time, yesterday, the dog couldn't move. So he came here, and you can see that she was panting in pain, and given IV drip, antibiotics and painkillers. 2016. This pom had overnight IV drip. You can see the tongue is a bit pinker, and definitely it's more alert, not recumbent. Can she stand up or not? Judy, see, she can stand up. Just given a bit of glucose. Let's see. Come, she can stand up.
What this one we buy?
Won't bite, won't bite.
We buy.
Bite means health, active again. Because the owner complained he couldn't stand at all. He might want some food. A bit of AD. This looks more alert for surgery. Come forward a bit. What was the temperature?
29.
So no fever already. Okay, I'll just stand. So you can stand.
Cannot.
So come. We'll be doing surgery in 2 hours time to remove the swollen uterus. Now diagnosis is closed pyometra, so the owner doesn't want blood test and X-ray. So based on observation, examination, and palpation, it's most likely closed pyometra, and also the vaginal discharge of pus and depression and fever. So we'll wait till 2 hours from now. And PA, gas only. Isoflurane plus oxygen. You can see the lobulated uterus, 4 parts is taken out. And there's a cause of the discharge, the pus in the vagina.